Welcome to the second episode of The New Normal, Understanding COVID-19 Stress as Communities Recover, presented by the Virginia COPES Warm Line. My name is Sadie, and I am one of the team leads at the Warm Line. And I would like to present today on emotional management and how that's going to help us through the changes that are going to come up as we progress through the pandemic and face this new normal. So first of all, I'd like for us to understand what emotional management is, and then I would like for everyone, by the end of this video, to find some sort of emotional management technique that works best for them. So starting with what is emotional management. Emotional management is about how you respond during intense emotions. What do you tend to do when you have big feelings? Do you avoid those feelings? Do you place blame either on yourself or other people or other factors outside of your control? Do you rationalize? Do you jump right into action? There are many more ways that you can manage emotions, but I'd like for y'all to take a second to reflect on what has worked well for you and what reactions have made those intense feelings worse in the long run. It's important for us to be really self-aware of how stress impacts us. Sometimes stress that is, not very high for other people can be really intense for others. So something happening out in the world, like the pandemic, might not faze everyone, but for other people, it's going to bring some heightened feelings of anxiety, sadness, isolation, loneliness in general. And we want to be sure that we're, keeping an eye out on how things in the world are making us feel. And you might be asking, how do I effectively manage my emotions when I'm facing COVID-19 related stress? I know I've asked myself that a couple of times over the course of the pandemic. I'm sure we've all had a moment in the last year and change where we've thought, how do I make this work for me? How do I make my feelings not so overwhelming? And today we're going to talk about how to handle the stresses that are on the higher end of the spectrum. So using this feelings thermometer between a 7 and a 10. In our next episode, we're going to talk about how we take care of ourselves when we're below a 7 so that we're less likely to get to a 10. But for now, we're going to talk about those high stress situations, those really, really big feelings, and what we can do to manage those emotions in the moment. So I'm going to talk about 3 main techniques that can bring us from a state of anxiety, general upset, stress, and bring us down to a more manageable level. So we're going to do what we can to work to move to a neutral emotional state. So we're going to regulate but not repress. We're going to challenge negative thoughts. Sometimes that's easier said than done, but we're going to talk through how that works. And we always have the option to verbally process feelings. So we'll start with getting ourselves to that neutral state. This is one of my favorite techniques. It's the 5-4-3-2-1 grounding technique. And this relies on using your 5 senses to put yourself in the present moment as opposed to, worrying cyclically about the past or worrying about the future and what ifs could happen. So we're going to start with 5 things we can see, then move to 4 things we can touch, 3 things we can hear, 2 things we can smell, 1 thing we can taste. And this allows us to say, these are the factual things that are around me that I'm experiencing. And it really takes our mind away from points in time that we can't control to the moment that we are actively in. And it goes from things that are easier to numerate, like what we can see and touch, to things that might be harder, like smell and taste, just because you're probably not actively eating when you're in the middle of a stressful situation. Maybe you are, and maybe that'll be easier to name, but we're more likely to be able to see and touch things than we are to smell and taste. So work from easiest to hardest, and that way that also won't additionally stress you out. I also recommend challenging negative thoughts. So this is something that you're probably going to have to practice considerably. We're going to be doing cognitive restructuring, which is just replacing a negative thought with a more accurate, helpful one. So in this example, we have I want to participate in an event, but not everyone will be physically distancing, and I could get sick. And this is a thought that might have some basis in reality. It's possible that people there won't be physically distancing, and it's possible that you could get sick depending on whether you're vaccinated or you're masking or whatever you're doing. But it is also something that we don't know for sure. We don't know whether other people won't be physically distancing. We don't know whether anyone else is there that could be sick to get us sick. And so these unknowns actually are not very helpful for us. And so it's better to restructure with things that we do know so that we can act accordingly. So maybe you're going into the situation and you're saying, I know I'm vaccinated, and while I have no control over other people, I can make the safest decision with the information available. You know, when you're going in, you might not know whether people are vaccinated, or you might not know whether they're physically distancing, but you know whether you're vaccinated, and you know whether you have a mask with you, and you know whether you're going to keep a safe distance from other people, depending on what's going on. Maybe you know whether you're comfortable enough to ask people if they're vaccinated, or you're comfortable enough to ask them to keep a safe distance away from you. We know that in certain social dynamics that might not always be the case, but you have that knowledge of what you feel comfortable with and what you can do, and that can help you feel more prepared going into a situation. And so you're challenging a thought that is full of things that you aren't sure about with things that you are sure about, so that you can feel more secure and go into this situation feeling less negative and more empowered. So hopefully, depending on the various situations, you'll be able to say, you know, I'm worrying about this thing. What can I control in this situation? And what am I worrying about that I can't control? And then you can start trying to reframe those thoughts using this method. And last but certainly not least, you can always process what you're feeling verbally. You know, maybe you are trying to do that thought restructuring, but you're not really sure where to go. You're not really sure what the different factors are, and you just need to process it with someone who's willing to listen and maybe give you some helpful feedback. So you could call the Virginia COPES Warm Line. We're available 7 days a week, and we're very happy to assist anybody who has any thoughts they need to work through, any concerns that they want to process. You can call or text us at our phone number that's listed on the screen. We have folks that are, you know, ready to just listen and say, you know, I understand what you're thinking and feeling. Have you considered framing it this way? Or, you know, what can I ask you the questions of what you do have available at your as a resource? Can I provide you with additional resources? And this way you just have someone to bounce your thoughts off of who's also a neutral party. We have plenty of other resources as well. Some of our colleagues in the field who can also help you with, you know, your thoughts and feelings. So Mental Health America Virginia has a peer-run warm line. AliveRVA has a warm line for those who are in recovery from addiction. There's a veteran crisis service line, the LGBT National Hotline, Virginia Crisis Response Network, and the Virginia CSB directory. All of these resources will be linked in the description of this video, but the Virginia CSB directory specifically will help you find your local community services board, and they can help you with the most up-to-date local resources around you if you have an emergency or a specific mental health need outside of someone else's hours. And maybe you know someone in the community who you'd like to connect with there. Or maybe you can make that connection through this resource. If you have any questions, you can feel free to email us at virginiacopes@gmail.com, or you can call the warm line with your questions. We will be there. I hope that this has been helpful as we move through the next few months of change. And as I said, if you have any questions, feel free to reach out.